Hello, my name's Nicole Martinez, and I will be interviewing Julia about her perspective and stance on the United States healthcare system. So, Julia, tell me about your stance or perspective of the United States healthcare system.
So, from what I know about the United States healthcare system, I feel like it's a very flawed system. I personally have a lot of personal experiences with it that have been very negative, especially when it comes to billing and things like that. I have the unique perspective of having three children, and so I've had to pay to give birth three separate times, and every time we get the bill, it's just insane to me how much it costs. And especially after learning about healthcare in different countries and seeing like how drastically different it is, it makes me really upset, to be honest, to just how the United States healthcare really does monopolize on its people paying instead of giving us the opportunities to have free healthcare like so many other places. So overall, like generally, I'm not happy with it at all.
You're not happy with that. I totally agree. Just from seeing, other countries and whatnot and how their healthcare is different. So, what do you think is something the United States could change or add to our healthcare system that you like? Maybe about Canada, where they have, the free healthcare.
Yeah.
Um,
So, I mean, there's never going to be a perfect system, right? I feel like so many people complain about different countries like Canada who do have the free healthcare that like it takes forever to get appointments or you don't get the quality care that you need. But I have heard the opposite at the same time, where it's just you never have to worry about if you're sick that you can get help. From personal experience too, like I've had instances where I've been very sick, but I do everything in my power to avoid going to the doctor because I can't afford it, or at
mhm.
least I don't want that huge bill coming, so I would rather be doing other things. And I just think that that in and of itself is just such a devastating thing that so many Americans will do anything in their power not to go to the doctor because of the price. But it makes sense. I mean, with the anyone who's had the experience of getting help and getting that bill, it's a sinking feeling because it should just be a basic human need to get help, but money is what's standing in the way, and it's just honestly quite devastating to me.
I agree. I 100%. I know that I'm going into the healthcare system as a nurse, and, my priority is to help, everyone, regardless if, money wise and whatnot. That's our main priority as, being in the healthcare. And it's unfortunate that, the hospitals or, even insurances are like, demanding so much money. And unfortunately, a lot of people aren't able to pay and they have to add that hospital bill on top of maybe other bills that they have
Yeah.
and that they are unable to pay. So it's definitely something that needs to be changed and whatnot. So
Yeah, and I've also had the unique perspective of being on Medicaid. So when I had my first child, we were like very poor college students, and so we were actually qualified for Medicaid. And like there's the difference of being on Medicaid and having that assurity that it's going to be taken care of versus me having to foot the entire bill. It was just so different. And it's sad too because it has nothing to do with the quality of care. Like I feel like in America, at least from my personal experience, I've had incredible care. Like my doctors have been amazing, my nurses have been amazing. But like I said, it's just the money that's standing in the way. And especially these days with inflation and the economy being as awful as it is, it's even more daunting to even think about getting a medical bill.
I agree 100%. So what are some of like the core values that influenced your stance on like the United States healthcare? Excuse me.
Yeah, no, you're fine. So honestly, the main one is transparency. I think anyone who's experienced getting a medical bill will know that you get this, if you're lucky enough to get an itemized list, if they'll actually give you one, there's so many things that you're charged that you didn't get the care for,
Mm-hmm.
or they'll do things that they didn't ask your permission to do that you have to pay anyway. And I just feel like that's so dishonest. So I just feel like transparency needs to be a vital part of the healthcare system, that you know exactly the care you're getting, you know exactly what you're going to be paying for, and you know exactly what you're getting into. Because I mean, I truly don't know of a single person that has gone through like either a major surgery or a really big health scare who hasn't had a really frustrating experience with the lack of transparency that they've been given. So that's a huge one for me. And
Mm-hmm.
another one going with transparency is honesty, because I mean, greed is a huge thing. And
Mm-hmm.
I feel like, especially with the healthcare system, like everyone needs healthcare, right? You can
Mm-hmm.
get away with being a dishonest doctor or just milking it for all it's worth. And I just feel like that's so dishonest. And so I just, the more honest I feel like my healthcare providers are, the more likely I am to go to them, even if I do have to pay, because I have that reassurance that it's going to be okay. You know what I mean?
Mm-hmm.
So that's another one. But the last one that I was thinking about um, is just common decency, and
Mm-hmm.
just doing to others what you'd want done unto you. And I feel like too often um, in healthcare, it's all about what do I get out of this rather than what do I give, which is so
Mm-hmm.
ironic because healthcare is human. I mean, you're working with humans, you have to care for the person and not just their wallet. So those are the
100%.
ones that kind of drive my purpose behind those.
I agree 100%. I do think, being a healthcare provider, we all are told, our main priority is helping the patients and whatnot. And so when you come across, some healthcare workers that are just in it for the money, it really has like a bad feeling, towards you, and you don't feel like great and you don't want to come back at all. I know luckily with my brother's surgery, he had his appendix removed, and it was just him and I up here. My parents were back home, and luckily
Oh,
the
that's
doctors were
hard.
amazing and the nurses were amazing. And I was a little bit freaked out, but I had like the best experience with the healthcare providers, which I want, like, think should be across the United States, not just
Yes,
very
absolutely.
few. Mm-hmm.
Well, like you were saying, I truly believe that our healthcare providers are some of the best people in this world, who are like literally willing to work each and every day to help people like save their lives, making sure that they have the best life possible. And so
Mm-hmm.
it's just so interesting that there could be such a stark difference, because there are some of the best people and some of the best experience I've ever had. But then there's like this corrupt part of it.
Mm-hmm.
He isn't the direct healthcare line worker.
Uh-huh.
It's like, I think it's unfair, almost like they get a bad rep on something that they have no take in. You know what I'm saying?
Mhm.
Well,
Yes.
I completely agree. It's just so important to have those positive experiences and to feel safe with those.
Hmm. Yeah. So with your core values, the ones you picked on your stance, who influenced you the most growing up, like to have those core values? Was it your parents, your grandparents, or, even now you have, a husband, who kind of influenced you with those?
So a huge one is my parents. My parents have always taught me to be honest and transparent. But specifically with this subject, actually, my grandma is a nurse, and she always, ever since I was a little girl, I remember her teaching me that you need to teach everyone as if their happiness and their belief in humankind is in your hands. And she used that
Hmm.
as a nurse, she said as a person. And
Hmm.
she taught me how important it is to be honest with everyone. And even if that honesty doesn't benefit you in the end, honesty is the best policy. So I'll just always think of my grandma when it
Your
comes to
grandmother, when you say that.
yeah.
Yes, those are super important. I know I'm also influenced by, my parents and grandparents as well and stuff. So my last question for you today is, have you ever had a conversation with someone else that had a different stance on the United States healthcare, like in a good way, like in a bad way, and how did that conversation go?
Yeah, so it was actually a really good way. I have a friend who, like you, is in nursing school, and she works at a really amazing hospital in Utah called Primary Children's Hospital. And she has had the opportunity to be on the administrative board as a nurse practitioner, and they're just doing so much good for so many families, and they're creating so many opportunities for families to get the not only the medical help that they need, but the financial help that they need with that. And so it's just so good to see the other end of it, where people are striving to not only give them the best healthcare possible, but to have the ease of the financial burden at the same time. So talking with her like really kind of reignited my faith in the healthcare system, and realizing that not everywhere is corrupt, not everywhere has a like a secret motive, you know what I mean?
I agree.
And so I definitely like my faith was restored more in the healthcare system through talking with her. So that was a very good conversation that I had with her.
Yes, well, I'm glad. Well, thank you so much for letting me interview you and getting your stance on, your the United States healthcare as a whole, and kind of bringing in the other countries and comparing them to one another. I appreciate it. So, thank you
Yeah,
so much.
no, thank you, Nicole. Have a great day.
Yes, you too.